Medspace.XR enables the student or learner to be immersed in this digital X-ray environment. Students will be encouraged to follow the process of taking an image, which would include setting up the room first and being organised before the patient comes in. Equipment can be moved by selecting it or clicking on it, or also some shortcut keys. We're positioning this tube ready to take images of a scaphoid. You can see the light is just coming in on the end of the table. We need to select how the patient's going to be positioned. They are randomly in position quite deliberately, so the students do have to manipulate the anatomy and think about the desired outcome. You can measure the tube, ensure that our source image distance is correct, and we have 110 centimetres as displayed through the tool drop-down menu. By selecting the patient's upper arm, we're able to do the movement of abduction, and that will get that hand in a better position. Individual fingers and thumbs can be selected in order to move the patient's anatomy as desired. So the tube can be moved in any way as long as the menu is up whilst looking from a different angle. We can reduce our collimation right down to the scaphoid, but without palpating this position, how can the students know how to position correctly? Under the tool menu, we can view this patient's skeleton, and the patient will move following the menus as desired, and we can see what effect that has on the underlying anatomy. We must complete our examination with the positioning of a side marker, and we can rotate that so we'll be able to orientate our images correctly. We can go to our exposure panel, select our exposure factors, as well as our image receptor requirements. So we have selected the cassette tube, 52 on 4, a prep and expose button. We can then view what that image looks like and orientate it correctly. We can then compare that with the technical standard, so the students can get instant feedback as to whether they have positioned and followed the process correctly.